Hello, today we are learning how to assist with the perineal care. For the HCA skill test, the client is a female mannequin and the client is laying in bed while this care is provided. This skill will be performed using soap and water, not wipes, so make sure you're using soaps and water. The supplies we need for this skill is like linen protector and a basin, soap and gloves and some towels and a pad. To successfully demonstrate this skill, you will need to use the swipes, communication, client rights, and common care practices. So you need to assemble your appropriate equipment before, and you need to wash your hands before and after, and you need to identify your name. Hi, my name is so and so, and explain the procedure to the client, what you're going to do, and provide privacy as needed, and scan the area for any safety issues. So before you start, you introduce yourself, you explain the procedure. So you need to fill the basin with water. So use the water that's safe and comfortable temperature for the client, and you need to adjust it as requested. Check it first yourself and take it to the client to check the water temperature. And you need to wear gloves all the time while providing perineal care, or while rinsing and drying equipment, or handling soiled linens. Protect clients' bedding from getting wet with a towel or disposable bed pads. You can put it in first before you begin care, and then you can take it out when you finish. So uncover the perineal area. Make sure the client's privacy is maintained all the time. So keep water in a basin soap free for use as a rinse. So there's two ways to do it. You might get two basins, one for clean water, one for soapy water. After you washed it, you can rinse it with a clean one, or you can get only one basin, just like I did, and use the soap. Put the soap on the washcloths. Do not put it in the water, only on the washcloths. These are the two ways to do it. So when we start, gently wash the entire perineal area with a soap washcloth. Use a clean area of each washcloth for each stroke. Clean from front to back. If you are standing like me over here, you can clean from front to back, front to back, front to back, three ways. So you can do that. You wash it first, and then you rinse it. Rinse entire perineal area with a clean washcloth. Use a clean area of the washcloth for each stroke. So rinse from front to back, front to back, front to back. That's the way you should do it. And then gently pat dry perineal area, moving from front to back. Usually pat it, and front to back, you dry it. So as you see here, you washed it with a soap, and then you rinse it, and then you dry it. Assist the client with rolling to the side. Make sure the client is safe distance from edge of the bed. So you have to clean the back side, just like this. It's easier to make the towels with the soap on it, and to rinse the towel with the water on it. Make it ready. When you're doing the back side, it's kind of hard to use two hands. If the person is stable and can stay on the side, it's fine. But the person is not stable, and if you have to hold it, this is an easier way to do it. So the same way we did at the front, we do it in the back. You wash, rinse, and pat dry buttocks and peri area, and use a clean area of the washcloth for each stroke, and wipe from front to back, avoiding contaminated peri area. So here I'm washing here. Wash perianal area. Use a clean area of the washcloth for each stroke. Wipe from front to back, front, back, front, back. That's how you wash it, and then you rinse it. Peri area. Use a clean area of the washcloth for each stroke. Wipe from front, back, front, back, front, back. Now it's time to dry it. You pat dry buttocks and peri area, and from front, back, front, back, front, back. You need to use a clean area of the washcloth for each stroke. Wipe from front to back to avoid any contaminating or peri areas. So you already put the pad earlier. Now you can replace it, or if you don't need it, you can take it out. Replace bed pad or bottom of sheet if necessary. Minimize exposure of the client body during the procedure. Then when you finish, leave client covered with top sheet and blanket at the end of the care. And remove soiled or washcloths, towels, bed pads, bedding, clothing, anything that you used. If it has to go to the laundry, put it in a laundry. If it's garbage, or whatever is supposed to go, put it back. Dispose of in a proper container after cleaning it. You remove your gloves and dispose of soiled gloves. And before you go, you ask the client, is there anything you need from me before I go? Things like that. And then you wash your hands and you're done with this procedure.